So when you think of who a cancer survivor is, anyone who's been diagnosed with cancer. And this begins at the moment of diagnosis and it goes through the end of life. So a lot of times we think of survivors only those people who have completed 5 years of treatment or who have completed all of their cancer treatment, but it's anyone. It goes from the very beginning, when you're getting your diagnosis, when you're getting your treatment, when you're dealing with getting therapies with the intent to cure your cancer, all the way, and even includes people who are dealing with metastatic disease or long-term disease for which they're getting treatment for 5, 10 years or more. And this continues through the end of life. When you think about survivorship care in clinics, a lot of times the focus is on long-term care, meaning for those patients who are past their treatment phase and are getting treated now with, and are getting now just watched to make sure the cancer hasn't come back. Now, the beauty about MD Anderson at Cooper is that we have programs that are available to you throughout your entire journey. Beyond the survivors, a lot of organizations also include our caregivers, include families and friends in the definition of survivors, because they are often facing similar problems as our survivors. Things like fatigue and insomnia, depression, all of those things they're going through with the survivor, but only about 1 out of 6 reports talking about their needs or having resources made available to them so that they can help survivors through their journey. And that we do know that for these families and friends, their problems and their concerns and their needs change along with the survivor's needs changing. So in the beginning with the diagnosis, the needs are different than survivors and family members and support when it's at the end of life or when it's long-term care. We also know that we are seeing a rapidly increasing number of survivors, that when you think back in the 70s, there was only about 3 million survivors, but nowadays we have over 17 million, which is about 5% of the U.S. population, and around the world we have over 32 million survivors. And those numbers are supposed to continue to increase. By the year 2029, we expect there to be about 29 million survivors. And about 19 million survivors. And the increasing numbers are due to the fact that we do have improved and more screening, that life expectancy does continue to go up post-treatment, and that we do have an aging population. And this disease is a disease that affects most people when they're older, which is why about 2/3 of our survivors are over the age of 60 and about 66% under the age of 40. Now, we know that survivors are living longer than ever before, and when you look at that 17 million survivors, what you find is about a third of them are survivors for about 0 to 5 years. About a quarter have survived 5 to 10 years, 16% 10 to 15 years, and look how wonderful that 15 plus years after diagnosis, we still have a large number, about 28% of our survivors. And those numbers will continue to grow as we continue to age and get past our diagnosis. Now, in terms of utilizing cancer services and primary care services, what we find is some of our survivors overuse those services and a lot of them underuse those services. When treatment has ended, we know that there should be a coordinated focus on looking at survivors for surveillance for recurrence of disease, as well as for screening for new primary cancers. We also want to monitor for late and long-term effects of treatment, as well as psychosocial effects based on the treatment that we've given patients and their diagnosis. We want to look at managing other medical conditions such as hypertension and diabetes, high cholesterol, and also look at routine preventative and primary care. Our studies show that both our oncologists and our primary care providers providers are overusing imaging and laboratory studies, which are not in line with the recommendations by national guidelines. A lot of times these are based on maybe survivors telling us about issues that they have and us ordering tests, or sometimes not knowing the correct imaging and labs that we should be ordering at which time phases of the survivor's lives. So in terms of providing surveillance for recurrence, we know that a worry of a cancer coming back or of a new cancer developing is a real concern for our survivors, and which is why giving screening tests and surveillance tests are so important. Studies show that mammography screening declines in breast cancer survivors over time, that in that first year after getting a diagnosis, about 80% of survivors are getting yearly mammography, but when the time goes by, that number continues to go down. And when you look at colorectal cancer survivors, only 70% of them are receiving the recommended follow-up care based on the national guidelines. So when you think about surveillance and recurrence risk, it is very individual to each cancer diagnosis and also based on the stage of diagnosis. So your providers, your oncologists are going to tell you what your risks are of your cancer coming back based on your stage. And some people don't want to know that number, and you don't have to. The important thing is knowing what you are at risk for and making sure you're getting the right follow-up for that. Now, we screen for a lot of other primary cancers. So if someone is, for example, a colorectal cancer survivor, we want to make sure that if it's a female, they're getting their breast cancer screening. If it's a male, that they're getting prostate cancer screening. If someone has a high risk of smoking, that they're getting lung cancer screening, and again, female cervical cancer screening. And for all our survivors who are at high risk of their bone density being affected because of their cancer or their treatment we gave them, that they're also getting bone density health screening. We also want to monitor for the effects of treatment. We know that cancer survivors are at risk for other medical conditions due to the cancer and its treatment. Chemo and radiation has been shown to lead to premature aging in our survivors of all ages, and also to increase the risk for coexisting conditions. These conditions are things like diabetes. I've had patients who we've been treating with steroids for their cancer to prevent maybe them having issues to their cancer treatment, and these patients now have issues with high blood sugar and develop diabetes down the line. Is it that those patients that we caused the diabetes? Not necessarily, but maybe we caused that diabetes to show earlier than what that patient would have had. We also know that when we think about long-term and late effects of treatment, that there is a difference. The long-term effects of treatment are those effects that begin during the treatment and may continue for months or years after the treatment has ended. When you think about late effects of treatment, those can begin months or years after the treatment has ended. Sometimes they can get worse as time goes on. Some of them can be mild symptoms, some of them can be severe or life-threatening, but they can impact the survivor based on the age when they were diagnosed and their developmental stage at diagnosis. As an example, if you were diagnosed with cancer as a young child, the late effects that you may have may occur sooner in you and may be more of an issue than if you were older when you were diagnosed and treated. So this is just a list of some of the common long-term effects that our patients may be dealing with, such as menopausal symptoms, those wonderful hot flashes that we can get after treatment, that peripheral neuropathy, which is that numbness and tingling that may not go away in your fingers and toes after your treatment has ended. And we know that there's a lot of our survivors that are dealing with long-term effects such as fatigue and insomnia, as well as sexual dysfunction, vaginal dryness, issues of erectile dysfunction, as well as dealing with things like chemo brain, and chronic pain can be a big issue as well. When you talk about common late-term effects of treatment, the ones that come on after the treatment has ended, it's really important for you to be aware of what to look out for, which is why something that Susan is going to discuss a little later called a Survivorship Care Plan is so important because it gives you that documentation, that information in a written document. And your late-term effects, your long-term effects are going to be specific to you, to your diagnosis, and to your treatment. But it's important to continue follow-up care with your team because they can look out for those late-term effects. If you think about common late-term effects, they include things such as bone loss and bone fractures, infertility, which can be devastating for some of our younger patients, having issues with your heart, such as cardiomyopathy, and also early menopause. And early menopause, when it's done at a young age, not when menopause is normally affected, can lead to other issues such as osteopenia, osteoporosis, and cardiac issues. One of the things that we really want to do is encourage our survivors to live a healthy life and to be physically active by maintaining a healthy weight. Because what studies are showing us is that this helps improve survivorship. It improves the treatment-related side effects and also the survivor's well-being. We do know that, unfortunately, our cancer survivors tend to have decreased physical activity once they have a diagnosis and during treatment. And the treatment factors that can worsen this inactivity include feeling tired, the weight gain that occurs post-treatment, and physical limitations, as well as some of the psychosocial effects of the cancer and its treatment. We know that survivors who smoke have a higher risk of other cancers, and that about, unfortunately, 12 to 15% of our survivors are current smokers, but it's never too late to quit and to get the benefits of quitting. And we also know that the use of everyday alcohol can increase the risk of other cancers. The guidelines are that our male survivors should decrease their alcohol intake to no more than 2 drinks daily, and our females to 1 drink or less a day. There's a studies that show that our breast cancer survivors, even 1 drink daily, can increase the risk of cancer recurrence and decrease survivorship, which is why it's important to do things in moderation. Now, what about financial toxicity? And we're going to have one of our nurse practitioners do a talk about this in the future. But we know that up to 2 to 3 of our cancer survivors have a significant economic effect burden on them financially due to the cancer and its treatment. And studies have shown us that about a quarter of our survivors use most of their savings during their cancer treatment, that 10% of them are unable to pay for their basic necessities such as food and housing, and that 8% did not get the recommended care because of the cost of that care. We know that our survivors have a higher risk of filing for bankruptcy, and about 12% of them were denied health care or life insurance due to their diagnosis. So this is a real burden. This is a real impact on our survivors' everyday lives. And remember, not just the survivors, but their caregivers and their families are impacted as well. Now, in terms of psychological health, we know that mental health is extremely important, that it affects our everyday, how we wake up, how we feel during that day. And cancer survivors have a higher reporting of poor mental health and poor quality of life than those without cancer. And the common psychological effects of our patients include depression and anxiety, those sleep problems, body image concerns, which can affect how they feel, what they do, how they lead their everyday lives, fear of recurrence, which in some of our survivors can be paralyzing and prevent them from enjoying their everyday life, and dependence on opioids, which could be due to the treatments that we gave them and the pain that they're experiencing due to their diagnosis and treatment. Now, survivorship during our pandemic. We know that the pandemic has increased what is already a complex cancer environment and care, and that it's been difficult juggling and balancing what we do for our patients. You know, we have to weigh delay of care versus harm from COVID-19. What about giving you the care that you want while maintaining a social distance? And also providing healthcare resources that have been impacted by the pandemic. This includes our healthcare team that can also be impacted by COVID, and that can diminish the number of providers and the healthcare resources and support that we have during this pandemic. Vaccination is extremely important. We encourage our survivors to get vaccinated, and if you have not been vaccinated and you have questions about the safety, please speak to your providers. Please speak to your primary care providers as well as your oncology team. This is something that is important for your safety, and we want to make sure that you feel comfortable getting your vaccination. And there's now other treatments that are available based on the individual needs of our survivors. So speak to your team if you're concerned about COVID or you've been impacted by COVID-19 to see what other care we can help you with. In terms of managing other medical conditions, your primary care provider is an extremely important member of your team, and we want you to continue to see your primary care provider throughout your entire journey. We know that patients with cancer have a higher risk of not receiving the recommended care for their medical issues, and that they think that the oncologist should be managing all aspects of their care. That is not the case. Cancer survivors have a higher risk of other medical conditions, and the primary care team is the best people to take care of those issues. Compared to our non-cancer patients, we as survivors have a 54% higher risk versus 45% of non-cancer patients of having other medical conditions. Issues such as heart disease and diabetes can really increase complications, not only of the cancer of its treatment, but unfortunately of our survivors having a higher risk of dying and also have a higher risk of not having these issues well managed. So it's important, and one of our focuses of coordinating care between our oncology team and our referring providers and primary care providers. So FDA Cooper has a lot of options for follow-up care. We have focused programs that for the clinical care of our survivors, and we ask you to please speak with your oncologist regarding which ones may be best for you. I'm going to leave you now with Susan Hunter, who is going to be discussing with you some of those clinical programs that we do have available for you. And please note that there will be time at the end for questions and answers. Thank you so much.
Good afternoon. I'm Susan Hunter, and I will be speaking to you about the levels or phases of care after cancer treatment and the specific survivorship-focused clinic visits that were developed to ease the transition from one phase to another. Based on studies by the American Cancer Society and the National Cancer Institute, and as just presented by Evelyn, we know that cancer survivors have unique physical, psychological, emotional, and social needs, and that they require specialized health services to address those needs. Our Wellness After Cancer Survivorship Program is an essential component of our Comprehensive Cancer Center and was developed to guide survivors like you from the time you complete active treatment through long-term follow-up care. Our mission is to enable you to live your life to the fullest. Transitions in life are challenging for most of us, regardless of our age or situation. In survivorship, we have learned over time that patients would like to have support moving or transitioning from one level of care to another. Two of these transition periods have proven to be particularly challenging, so we have created two distinct survivorship-focused clinic visits to try to meet the need for guidance and knowledge in times of heightened uncertainty. The two types of visits are the end of active treatment visit and the long-term survivorship follow-up visit. When active treatment, which means systemic treatments like chemotherapy and immunotherapy, also radiation therapy, when they end, the focus of care changes from treating and eradicating the cancer to identifying, preventing, and controlling side effects of cancer and its treatment, monitoring for signs of cancer recurrence, and promoting health and wellness. Once active treatment is over, patients are faced with establishing a new life, often referred to as a new normal. It's a time that is fraught with mixed emotions for many. Some individuals may be happy or at least relieved about completing treatment and having fewer appointments with the cancer team. Others may not. Some may feel well enough to resume activities in their former social roles. Others may experience physical, functional, or emotional limitations due to cancer treatments or to other ongoing psychosocial health issues. Some may look forward to returning to work. Others may have lost their job or don't feel confident enough to return. Many survivors cope well, whereas uncertainty and concerns about the future can cause significant distress in others. We offer two services to directly address your questions and concerns in this immediate post-treatment period. The first is the end of treatment visit. This is a one-time 60-minute clinic appointment with one of our cancer center nurse practitioners, and you will be seen in the same clinic facility where you were treated. During the visit, the nurse practitioner will ask you questions to assess your physical, emotional, spiritual, and financial health, perform a physical exam, and review in detail with you the survivorship care plan that was created specifically for you. So what is a care plan? It is a written, personalized document that has two sections, a treatment summary and a care plan. The treatment summary documents your cancer journey to date, so it's the past, including a summary of your treatment, so chemotherapy, hormone therapy, other systemic treatments that you've had, radiation, and surgeries. It'll document when and where these treatments were given, how you tolerated them, and if a change in treatment was necessary. A list of your cancer team members, past surgical and medical histories, medications, and genetic testing results and/or clinical trial participation if appropriate. Here is an example of a breast cancer treatment summary and care plan. And if you look down, I hope you can see this, if you look down the left-hand column of each page, you're going to see what I was just talking about. So you've got patient information, the care team, diagnosis information, the histology, the staging, in this case, estrogen and progesterone receptor status, some background information. On the back page here, there's a listing of the surgeries, all the chemotherapy or immunotherapy drugs that were given will be listed with an end date. Targeted therapies, hormonal therapies, radiation therapies. So there's enough detail that it will inform your primary care, and it will remind your care team of just what you've been through. The second section is the actual care plan and or guide to your future care, and includes recommendations about which providers to see and how often, when cancer screenings are due, strategies to manage post-treatment side effects, how to recognize the signs and symptoms of cancer recurrence, recommendations about risk-lowering healthy behaviors such as exercise, diet, limiting alcohol, stopping smoking, sun safety, and the resources that are available to you at MD Anderson at Cooper, in your community, and on the internet. Our expectation for this visit is that we will have addressed and hopefully answered your questions and concerns. Referrals to specialists will be made as needed. And here is some images of the rest of that survivorship care plan, and this is the care plan itself. So you can see here possible late effects of the treatment that you were given, what your follow-up schedule should be in this top line in the second section. We talk about monitoring bone density, echocardiogram or MUGA scan if you've had medications that could affect your heart, cervical cancer screening, colonoscopy, and so on. If you're due for ultrasound or breast MRI, skin exams, that's all listed on the second page here. Then there are recommendations about healthy living. And on the very back page, there are reasons to call. So this will help you to monitor your own health, and if you're at all concerned, we really encourage you to call us. There's no reason for you to sit at home and be worried about something when you can call us and hopefully be reassured that everything's okay, or that we will take care of you. So why do we feel that the survivorship care plan is so important for you and your health care team? Because it improves communication. It communicates vital information about you to those who are currently taking care of you and to those who will be looking after you if you move out of the area. It's a written record for your personal file and a part of your permanent medical record. We believe that improved communication should lead to improved care, because the more your entire team knows about you, the more focused, coordinated, and appropriate your care should be. The second service offered for the immediate post-treatment period is What Next, where what stands for Wellness and Health After Treatment. It is a 40-minute live educational call-in session. These sessions are scheduled twice a month and are led by Cancer Center nurses. The schedule and call-in information are listed on our call-in class schedule flyer and on our website. Roxanne will be providing information about how to access this class in the next part of our talk. Discussion topics are directed by your questions and concerns, but we have found that topics frequently include the challenges of adjusting to life changes, ways to cope not only with the emotional impact of completing treatment, but new worries, managing post-treatment side effects, physical and emotional, advice on who to call if you're worried or need to make an appointment, and information about support services, resources, and programs. This immediate post-treatment period marks the start of what is called the close monitoring phase of care. This phase typically lasts 2 to 5 years and is the time when the risk of cancer recurring is its highest. As a result, follow-up visits with members of your oncology team are scheduled every 3 to 6 months. Many of you will be on hormonal therapy or some other type of maintenance therapy during this time, and we strongly recommend that you continue to see your primary care provider on a regular basis, as Evelyn had mentioned. Once the close monitoring phase of care ends, the opportunity for long-term survivorship follow-up care begins. This next level of care is considered a positive step because it indicates that you are doing well, that you have no evidence of cancer, that you have passed the highest risk of recurrence, and that you no longer need the close monitoring of your entire cancer team. Your readiness to transition to long-term survivorship care will be determined by your medical oncologist and you. The decision will be based on the type of cancer that you had, how long it has been since your diagnosis and the end of active treatment, how well you have recovered from your treatment, your risk of recurrence, and your overall well-being, including other conditions that you may have, such as diabetes, neuropathy, depression, COPD, pain, and so on. Long-term survivorship care will focus on keeping you well and improving your quality of life. We will continue to provide specialized survivorship care that includes assessing your overall health, physically, emotionally, and socially, continuing to screen and monitor you for signs and symptoms of cancer recurrence, promoting healthy lifestyle choices and risk-lowering activities, and continuing to coordinate your care and making referrals to specialists as needed. This level of care is provided through our long-term survivorship clinic. And this is the second visit that is specific to and a vital part of our Wellness After Cancer Survivorship Program. This clinic is led and staffed by Cancer Center nurse practitioners and has dedicated space in our Cooper Specialty Care facility in Cherry Hill. Each 30-minute visit includes a physical exam, a health history review, identification of new or ongoing concerns or issues, and all of the wellness-focused interventions that I have talked about that characterize this phase of care. In closing, I want to reemphasize that all of the MD Anderson at Cooper Cancer Center and all of the Survivorship Program services, activities, and programs that Roxanne will always available to you. We welcome and look forward to your participation. Roxanne will be with you in just a couple of minutes.
Good afternoon, everyone. My name is Roxanne Berger, and I am the Survivorship Program Coordinator. This afternoon, I'm going to discuss the programs, the new and improved and exciting programs that we have to offer you through our Survivorship Program. As earlier discussed, our Survivorship Program is focusing on the needs of our cancer survivors and help them live their lives to the fullest. We're more inclusive, and we work closely with other departments, physical therapy, our outpatient rehab, nutrition, neuropsych. Some of the new programs include a virtual education series, our What Next series, an online discussion forum that talks about sexuality, our bone health, and our fan program that will begin tonight. I just want to discuss our programs a little bit more in depth. Our monthly educational series is a virtual online lecture, like today's lecture, in which we talk about different topics that are of interest to our survivors. This began in 2021, and some of the subjects that we discussed were men with cancer and healthy living. We talked about how to deal with insomnia. We had talked on managing and strategies to manage chemo brain, just a few that were mentioned. Up and coming that I'm excited about for the year of 2022 is heart health for survivors coming up in the month of February, dealing with fatigue and debunking the myths and misconceptions of supplements and genetic updates. Throughout the year, you should receive an email invitation to our live events. All of our events have been recorded and can be reviewed or viewed on Cooper's YouTube channel. As Susan had mentioned earlier, What Next is an exciting call-in session that takes place twice a month. We have an access code that is the same throughout the year. So once you have the call-in number and access code, you will utilize that number throughout the year. You can come on once or twice, or you can come talk to us on an ongoing basis. We have an afternoon at 1 and a 4 p.m. session. Our Bone Health is a new program that's been up and running for the last year. It is an APN-led initiative, one-time visit for patients who have osteoporosis or osteopenia or who are at risk of developing them. Referrals must be made through your oncology provider or nurse, and it is a multidisciplinary effort between physical therapy and your dietitian. Once you have completed your APN visit, those that are interested will be referred to either orthopedic or endocrinology to manage their bone health. We also have our Neurocognitive program, and those referrals are also made through your oncology provider. And those referrals are patients who might have some cognitive changes, patients who might have a loss of concentration, who have memory issues, problems with multitasking. If you feel like those are issues that you are dealing with on a regular basis, then please talk to your oncologist about making a referral via the neurology administration. If you have any questions or concerns, you can reach out to me. At the end, you'll see my number and my email address that I'll put in the chat for our participants today. Sexuality Counseling. We have a program that we have developed that is designed to help participants gain the tools and the resources to communicate with their partners and others regarding cancer-related sexuality and relationship challenges. Our facilitator is a certified sex therapist who is bilingual. There are monthly call-in sessions. You must come through me so that I can screen you for the appropriate group discussion. My email, just in case I am unable to put it in the chat, is Berger, Berger-Roxanne, ROXANNE, @cooperhealth.edu. And another one of our wonderful programs that started this week, actually, our first session will be tonight, is our Fitness and Nutrition, our fan club program. Walk, talk, stretch, thrive, and breathe. We all know that fitness at any level can boost your mood, reduce stress and anxiety, and improve sleep and build strength and endurance. So we know that healthy lifestyle changes can increase your stamina and your stability, and I am encouraging you to please come out and participate tonight. It is a 1 hour, twice a week, 10-week series where we will be doing gentle moving and stretching and discussing healthy lifestyle tips. To register, though, you need to email me, and I can send you the link for tonight's opening session. Apologize for that. Coming up in March, another exciting program that we have is our tobacco cessation group counseling. Earlier, you heard Evelyn talk about how 12 to 15% of our survivors still smoke. And we know that smoking is very detrimental to your health. So this is an 8-week tobacco cessation series that is designed for people who have quit smoking or who are on a nicotine replacement therapy that need a little bit of hands-on coaching, of walking through your journey while you're trying to quit. We know that nicotine is very, very addictive and can be one of the hardest drugs to stop. I also want you to know that there is individual counseling with a tobacco treatment specialist for those who want to quit. And the number for that I will be providing at the end of the session. Some things to look forward to. We're going to have cooking demonstrations where a registered dietitian will be providing a healthy food demonstration, mainly plant-based, because we know that plant-based is much better for you than processed foods. Also, we have for our breast cancer patients, a Strength After Breast Cancer program. It is a nationally recognized program that is administered by a certified lymphedema specialist, and it is designed for breast cancer patients who want to manage lymphedema risk and increase strength. Coming soon, hopefully we'll have dates for those programs for you in the near future.